The number one way Americans register their wishes to donate is when they get their driver's license renewed or get their initial driver's license. And increasingly, people are getting their driver's licenses later and later in life, and they're doing a lot of renewals online rather than in person. So if you get your renewal in Texas, that's about once every 4 years. So it's only once every 4 years you might be presented with that question. So one of the major efforts in the country is to try to find new opportunities, different ways that people would see an opportunity to register their wishes. One is Texas recently began to allow you to register your wishes to be a donor when you got a hunting or fishing license. Another really remarkable opportunity in the country was in about 2015, in a partnership with Apple and iPhone. They allow you, when you set up your phone, you set up your health app, and it asks you if you want to be an organ donor. And 5,000 people a day register their wishes on a health app on an iPhone. So when you come to or arrive at a hospital or doctor's office or emergency room, all efforts will be made exhausted to save your life. And it's not until after your life can't be saved that anyone would even check if you were a registered organ donor or begin that conversation with your family. Well, the way the waiting list works is a patient gets placed on the waiting list and they include their blood type, generally their height and weight. Those are factors that are important for how an organ is matched with an individual. Your income, your celebrity status, none of that is even entered into the national waiting list. And there is just a single waiting list. Everyone in the country who's on the waiting list is just registered through one site. Individuals who've been corneal donors, tissue donors, and organ donors, their families are still able to have an open casket funeral, able to have a viewing. The process to recover donated organs, eyes, and tissues is done in a surgical, dignified manner, and it doesn't prohibit the viewing. We have many living donors who've donated kidneys and donated a portion of their liver to save someone's life, and they have successfully had children after donation. There's a short period when a living donor is immediately recovering from a living donation that we would, not encourage them to get pregnant, but certainly there is no ramification or prohibition from them having a child after living donation. You don't have to be a family member to be a living donor. You don't even have to have the same blood type anymore. We're really now, thank goodness, only looking for a person who's healthy and able to be an organ donor. From there, if we find that they're not a suitable blood type match, then we line them up with another pair who might have the same incompatibilities, and we can do a paired exchange. All major religions in the United States support organ donation. None oppose it. For becoming an organ, eye, or tissue donor, there is no upper age limit. That decision is made at the time someone passes away based on their medical condition. For living donation, we will allow anyone of any age to be tested, but in general, to go through living donation, most of our living donors are under the age of 70 and over the age of 18.